Hi there, I'm Michael from First Aid Oz. Today we're looking at CPR or cardiopulmonary resuscitation. In this video we're going to cover two possible scenarios. Okay, one where you're performing CPR without the presence of a defibrillator, and then secondly how we incorporate the defibrillator into the resuscitation process. So let's start off first of all, as you covered earlier in your course, or if you've done first aid previously, your doctor's ABCD acronym, your emergency management plan. You went through dangers, you checked for response. Okay, if the response wasn't what you wanted, you sent for help in the form of calling 000, and then you looked at airways, breathing. You got to a situation where the person both wasn't responsive, let's say unconscious and not breathing. Then you're at that point where you need to consider doing CPR. So in this situation, like I said, you don't have a defibrillator present. Now that might be perhaps your workplace doesn't have one, or the environment that you're in where you come across this situation, there isn't a defibrillator present, or you're out and about, you might be out on a trip or something, and we come to this situation. So without going through the full doctor's ABCD, we're going to sort of jump forward a little bit to the CPR process. We've got that covered in another video. So like I said before, obviously we assume it's safe to proceed. We check for response, there was no response. We consider the person being unconscious. At that point, we rang emergency services who would send some paramedics, send an ambulance out, and 000 is the number for that. Okay. One possible reason the person could be unconscious is there's something obstructing airflow. So we're looking into their mouth to see if there's any objects and so on. If there are, we try to dislodge them, and if there's not, then we proceed to check for breathing, looking for inflation, rise and fall of the chest, any airflow through the nose and mouth, or the sound of any breathing. So there could be slight gasping, which is not a full breath, not an exchange of gases. We would also consider that to be not breathing for the purpose of CPR. So basically what we're looking at here is the person's not breathing, the heart has stopped most likely, unlikely that one will continue without the other. They kind of do rely on each other largely. So we're effectively becoming a substitute heart and breathing mechanism for this person. So if we look at a couple of different variations of CPR, the first one is the one that we've been doing for quite some time, and that is where we commence with 2 rescue breaths and then we do 30 compressions. There are, like I said, a couple of variations. So in this scenario, we're basically looking at massaging the heart or compressing the heart to try and squeeze out any blood that's in the heart, to basically try to get some of that blood to the brain, okay? But we need to put some oxygen into the person's lungs so that it's the oxygen in that blood that can minimize or slow down brain injury, which is the primary purpose of CPR, not necessarily to bring the person back as such, but primarily to reduce the rate of brain injury or the severity of brain injury, so that when a defibrillator arrives, whether it's on site, someone has gone to get it, or the paramedics arrive, or whatever the case might be, that the brain has suffered minimal injury. Okay, so a few guidelines when it comes to CPR. Okay, one is, we're assuming in this case this is an adult. Okay, so with an adult, we're looking at a third of the depth compression of the chest. Okay, generally that would require 2 hands, bottom half of the sternum. So you want to be using the heel of your hand. Okay. Now whether you interlock the fingers, place the hand on top, grab your wrist, that's entirely up to you. What's important is that you get the adequate compression, which we'll demonstrate in a moment. The other thing in regards to compressions, we're looking at the rate of 100 compressions per minute. Now we're doing them in cycles of 30 with the 2 breaths. When it comes to the breathing, okay, for an adult, we're assuming full head tilt, okay. Need to seal the nostrils, okay. Pistol grip on the chin to force the mouth open. Now obviously this mannequin is precast. Force the mouth open, we breathe and we look across, breathe and we look across. Okay, and then we go straight into 30 compressions. Okay, with the compressions, nice straight arms, you want to be over the top. Okay, you don't want to be sitting back. Okay, and so you would compress nice and strong. Okay, like I said, third at depth of the chest. Okay, so let's assume we did 30. We go back to the breathing. We do 30 again. We check condition hasn't changed, and then we continue that. We continue the CPR effectively until we can't continue anymore. Until the defibrillator arrives, we apply the defibrillator, and then we follow the instructions of the defibrillator, which may mean we have to continue to do CPR, particularly if there's no heart rate detected. Of course, if the paramedics arrive, if the person was to make some sort of recovery. Okay, so there's a few situations there. Now you might get to the point where you're doing a few cycles of CPR and you start to fatigue, because it is quite a tiring process. If you have another person there, it is possible for them to take over and continue the CPR rather than you doing it in a fatigue state, because the compressions will get weaker, they'll get slower, they'll become less effective. The primary important thing here is we need to get adequate compression to squeeze the heart. So don't focus on just pressing the chest, but pressing through the chest into the heart. That's important. Compressions are too soft, it's not very effective at all. So if you had a situation where you had another person there, even if they're not CPR trained, I mean ideal if they are, but if they're not, allow them to do a cycle or two just to get catch your breath, and then you can replace them again and carry on, and you can guide them through it. Okay, but of course if you can soldier on yourself, that would be fantastic. So that's the version without a defibrillator. So let's assume that we had a defibrillator handy. Now of course, if there's a time lapse between you coming across this patient, all the same steps we went through before, and getting the defibrillator, we commence CPR just as we did before until the defibrillator got there. Okay. The only exception would be if you're on your own. Okay, if you're on your own and you know where the defibrillator is, you need to go and get the defibrillator first. Okay, come back, apply the defibrillator. Okay, don't do a couple of cycles. Okay, and then at some point say, well, I think I should get the defibrillator. So defibrillator, this is just a training model. Basically they come with the two pads once you open them up, and the pads will show you where to put the defibrillator on the casualty. So in this case, it would be, we'll just place it on top. One on the right chest and one on the left rib cage on the side, effectively setting up a circuit with the charge going through the heart. And then you would turn a defibrillator on, okay, and it effectively will tell you what to do.
Analyzing heart rhythm.
So it's checking for the heart's rhythm.
Do not touch the patient.
We need to stay clear because we don't want it to pick up our heart rhythm.
Shock advised.
So it's advising a shock because it hasn't picked up a heart rhythm.
Charging.
Okay, so
stay clear of patient.
Again, it warns you to stay clear. And
deliver shock now.
You're manually
press
delivering
the
the
orange
shock.
button now.
You press the button.
Shock delivered.
It quickly checks again.
Pause. If needed, begin CPR.
Okay, so if you don't notice there's a return of breathing, okay, then you need to be doing CPR. So again, either start with the breaths or you can start with the compressions. Now, I mentioned before there is variation. One of the variations is whether we start with the 2 breaths and 30 compressions as we've done for the last decade or so, or now the possibility that we start with the compressions first and then the 2 breaths afterwards. And you might do that in a situation, for example, where the person has collapsed there in front of you and you saw that they took their breath only moments earlier. There's oxygen in the blood. Okay, we want to move that blood first. Okay, then after 30 compressions, we go to the 2 breaths. Whereas if I came across a scenario where I discovered an unconscious person, I don't know when they took their last breath, that might be a situation where I would start with the breathing first. There is a third option, of course, and probably more so now, you know, with the advent of COVID, where people may be really reluctant to do the breathing, particularly where you don't have PPE. Now, we know in the workplace you should have PPE, but if you're out and about just on a regular, you know, trip down the street, you probably haven't got all your stuff with you. So in which case, you know, you don't have your gloves, you don't have your mask, and so on and so forth. You may opt just to do the compressions. And that's fine in that situation because when we talk about our doctors A, B, C, D, this first stage of that is dangers, and one of the dangers is risk of infection to yourself. Okay, so in that case we can do the compressions. Okay, 30 compressions as we did before. Okay, now the obvious question that people are going to ask, we continue to 30. The obvious question people will ask is, where's the oxygen getting in? So there is a little bit of air that comes in when you release the pressure of the compression. Creates a vacuum effect. Not as effective as you breathing in yourself, but better than nothing at all. So anything is better than nothing in this stage. If nothing is done for this person right now, they have no chance of survival. We don't necessarily have to stop at 30, I did say 30, but in the case where you're not breathing, you just continue to compress. Okay, continue to compress, and like I said, same thing until paramedics arrive with a defibrillator or someone has run to get the defibrillator. Now, in the case where you do have some PPE, you'd have your gloves on. Obviously this is not a real person, so I haven't worried about that at the moment. But the other option is you have a mask over the top. Okay, press that in and you can breathe through the mask, and you're looking for inflation of the chest. So this is an important piece of equipment. Again, you might be something you'd consider keeping in your glove box of your car. Comes in a box like that. A lot of first aid supply places sell them. Okay, not overly expensive. Keep one in your handbag. Like I said, keep one in the boot of your car. Keep one in your first aid kit because it is handy. All right, so that pretty much is the process for CPR. Like I said, we're looking at 2 breaths, 30 compressions at the rate of 100 compressions per minute. When it comes to the assessment for the course purposes, we run you through the doctor's ABC process so that you recognise the situation where the person requires CPR, and then you perform a 2-minute cycle on an adult mannequin. In this case, we're using the adult mannequin. Okay, so thank you.